Hello, my name is Rich Harrison. I'm a neurosurgeon at the BayCare Clinic in Green Bay, Wisconsin. In any event, I just wanted to share a vignette about a bicycle accident I had and share the experiences that may benefit others. I was riding my bicycle out in the countryside, which I had often done, and I was riding a road bike going about 20 miles an hour. I was wearing my bicycle shoes with the shoes clipped into the heels. And I was just going down a country road, and all of a sudden out of the corner of my eye I saw quite a large black dog running right towards me. Now, this is not an uncommon thing that occurs when you're riding in the country, as most bicyclists can attest. You just typically keep riding, and the dogs will just kind of start running alongside you, and you just outrun them and they go back home. That happens all the time. In this case, the dog just ran right at me and kind of intercepted me and then jumped up on me from the side. Now, as you know, with a bicycle you have a lot of stability going forward and backward, but really not much from the side. And so when the dog hit me from the side, I kind of went over and landed on the hip and the back of my head. Fortunately, I was wearing a bicycle helmet, which I always do, and the bicycle helmet absorbed a large portion of the shock. I still had a substantial concussion, and that concussion affected me in the way that I didn't really know where I was, and it affected me in the way that I couldn't do common things. I started walking back towards my house in the general direction, although I don't think I could have found it on my own. I realized after a while that I had my cell phone, and I said, well, I should just try to call my wife and maybe she could pick me up. But I could not figure out how to turn my cell phone on, and I couldn't figure out how to dial my number. So I kept just walking in this general direction, and then my wife did call me on my cell phone. So I was able to answer the cell phone, and after a while was able to tell her where I was. I was able to find a street sign, and that street sign with the intersection was able to guide her to where I was. Fortunately, her father was there, and her and my father-in-law came, and they picked me up and took me to the emergency room at Aurora BayCare Hospital. There I saw Dr. Chris Sorrells, who evaluated me and noted me to be very repetitive, and we ordered a CT scan, which turned out to be fine. I do keep the helmet that I was wearing as a teaching aid for patients to show them the importance of the helmet and to show them what factors you should be concerned with when riding a bicycle helmet. Obviously, first thing, the helmet needs to fit. The helmet needs to have a chin strap which holds the helmet securely, so obviously if you're falling over it doesn't go flying off and not provide the protection. Again, I was hitting the back of the head, and one can see the styrofoam is disfigured here. That shows that the structural integrity of this helmet is now not there. It won't provide the protection that it is required to, and so a helmet is only to be used for one impact. It's not like a hockey helmet that's used for repeated impacts. And the main lesson, though, is to wear the helmet. Everybody riding a bike should wear a helmet because you never know when this is going to occur. I've ridden in the country many, many times. You see occasionally when you're riding, you'll see families riding, you'll see children typically wearing helmets these days, but you'll also see the parents not wearing helmets, which is kind of a bad example for the kids, and when they get older they're going to probably feel that they shouldn't use it. Again, in my case, I would probably be out of the practice of neurosurgery. I'd probably be laying in a nursing home or laying in a gravesite someplace. So I strongly encourage people to use helmets. You never know when it can happen, and it only takes once.